Welcome to the Kaleidoscope of Possibilities, Alternative Perspectives on Mental Health. My name is Dr. Adriana Popescu. I'm a licensed clinical psychologist and leader in the field of mental health, energy psychology, addiction, trauma, and empowerment. In this podcast, we will be exploring mental health from a variety of perspectives, from the spiritual to the shamanic and beyond. What if mental illness isn't everything we think it is? What if everything we see as a pathology is actually a possibility? What else is possible with mental health? Hi, everyone. Dr. Adriana Popescu here with you again today with another episode of Kaleidoscope of Possibilities, Alternative Perspectives on Mental Health. And I'm really excited to have with me as my guest today, Julie Bjelland. She is a psychotherapist specializing in high sensitivity. She's the host of the HSP podcast and founder of the Sensitive Empowerment Community, whose mission it is to create a paradigm shift where sensitivity is embraced, valued, and honored. Julie offers multiple essential resources for educating, inspiring, and empowering HSPs. You can register for her free masterclasses, take the sensitivity quiz, and profoundly transform your life in her courses and community. Her HSPs in Business Group is designed to support and empower sensitive people to grow heart-centered businesses, share their voices, and be part of the change the world needs. She even has an HSP dating group, which is a safe space to bring together conscious, kind, caring, sensitive people, offering both hetero and LGBTQ and HSPs. Welcome, Julie.
Thank you for having me. So happy to be here.
Yes, thank you for being here. I love to always start with my guests to just hear a little bit about your story. Like, how did you come to do this work? What led you here? What were some of your own experiences that got you to, especially working with this topic?
Yes, well, I am a highly sensitive person myself, and we call that HSP for short. And I was really struggling with sensitivity in my life, as a lot of sensitive people do, really challenged by it. And I became really interested in, how can we kind of remove some of these challenges? And the more I learned about the trait, because this is for your audience kind of new to learning about it, it is a trait that's scientifically proven, and it's about 20% of the population has this trait. And it is really incredible to learn about it. Most people who learn about it, I think it's incredibly profound. And that was my experience too. I literally cried when I learned about it many years ago, because it was like, wow, there's a reason why I feel this way. And there's other people like me. And I know a lot of sensitive people get messages that something's wrong with us for our sensitivity. And really it's the exact opposite. There's nothing wrong with sensitivity. It's just that we live in a modern, chaotic, loud world that is difficult for sensitive people, but we have so many gifts that are available and that the world really needs. And so the more I learned about it, the more it changed my life. And I really got interested in the brain and how do we, even things like you can activate calming centers that deactivate stress centers. And, that was really profound to me, that I could actually do something about my challenges. And as a psychotherapist, I started to specialize in sensitive people, and I started to use these tools with them. And it was really profound, the impact for all of us. And it really became this movement, this real grassroots movement, that we need sensitive people in the world. This trait evolved as a survival strategy of the population. We really are needed. And it's really incredible to witness the blossoming that happens with a sensitive person when they're given these tools to really balance the sensitive nervous system.
Yeah. Well, and that's what I wanted to ask you is, what exactly does it mean to be sensitive?
Yeah, so it is a trait. It's something you're born with. It's equal in gender. About 70% of us are introverts, 30% extroverts. And I name that just because it's important to understand it's not the same thing as introversion. And we have, in general, if you think about the senses, there's a lot of heightened experiences. We even have brain differences that make us experience the world in a different way. And there is a scale of sensitivity. And that's interesting too, because the higher you are on the scale of sensitivity, we call that HSP empaths, who are at the highest level of sensitivity, who really have the highest level of challenges, but also the most gifts. Like we can read, body language and micro expressions and energy that most of the population misses. If you think about the nervous system as being like a container, a sensitive person might have 100 cups of stuff dumped into that container every day that they need to process, and that's information. And a non-sensitive person might just have a few cups. So really the challenges come from if we're overloaded. There's issues with sensory overload, for example, if we're amongst crowds or loud noises or bright lights or things like that, can be even textures, fabrics, scratchy fabrics, wool, things like that. A lot of sensitive people are impacted by. It's incredibly fascinating to learn about this trait. And we have a lot of research about it too. One of the things that I love to share is that it is not a disorder. And one of the reasons we know about this is because we know that sensitive children raised with the right kinds of support actually thrive more than non-sensitive children and are less likely to have anxiety and depression. But the reverse is also true, that if we weren't given the right kinds of support, and a lot of us weren't because our parents didn't know about the trait, then we are more likely to have anxiety and depression. So how we're raised has a significant impact on our well-being.
And has the science shown, do we know yet if this is are we more predisposed genetically? Or, I mean, even if you think about, you live inside your mom for 9 months as a little baby, does her kind of sensitivity impact even a developing fetus? Do we know anything about that?
At this time, the research is showing that this is a genetic trait. And we certainly are impacted more by traumatic experiences, but things like trauma, things like something that our mother went through, we don't really have research that's showing that that's the cause of sensitivity. At this point, it is really a genetic. So most of us, when you talk to people about the trait, almost everybody is like, oh, my mom is, or my dad is, or, I know somebody in my family who is, because we actually think that about at least 50% of clients in therapy have this trait, which is really high since it's only 20% of the population. But we actually do really well in therapy. So that's actually something really recommended for a lot of sensitive people.
Yeah. So I want to piggyback on that. So I work, one of my specialties is addiction, and I work in a addiction treatment center that specializes in trauma. And I would say 100%, almost like 90% of the people we're seeing, and that even I see in my private practice, have this sensitivity. And, we see the coping strategies they try to, develop that aren't so healthy, right? Like I work with a lot of people who are using drugs and alcohol or food or something in a more addictive way to try to quell some of that sensitivity, which I even, I often call it awareness. It's just your awareness. You're so aware of everybody else's feelings and thoughts and even their physical sensations, right? Like you can feel in your body what someone else has going on in their body. And it can be overwhelming. Like you said, it's stimulus overload.
Yes.
And so people will turn to all kinds of not so healthy behaviors to try to cope with that. Can you say more about that?
Yes, I love that you're talking about this, because I would really love to see research in this area, because I agree with you. I actually believe that a lot of people struggling with addiction have this trait. There's a lot of things attached to it too. Most of us were raised thinking there's something wrong with us because we were told something was wrong with us. And you constantly that was my experience. Every sensitive person I've almost ever spoken to had these experiences. They hear, why are you so sensitive? What's wrong with you? So not only are you walking around in the world with a really overloaded amount of emotional experiences. And for a lot of people, like I used to describe it as, I felt like my nerves were exposed. Like I was just raw, walking around in the world, without tools, without knowing how to support myself through it. And not only that, but we're getting messages that something's wrong with us. So now we've got that 1,000-pound weight on top of the issue. Yes, definitely. It makes sense that people are trying to numb themselves. And this is something I think could be really profound to research.
Yeah. So when you work with clients in your workshops or classes and one-on-one and stuff like that, what kinds of things do you teach them might be better ways to manage their sensitivity?
Yes. Well, first of all, it's hugely important to learn about the trait, to really understand yourself and your experiences, because you'll have a lot of aha moments. And I kind of think of it as 3 steps. The first step is to learn about it. The second step is to actually learn some of these tools that help you balance a sensitive nervous system, and to spend time with other sensitive people, because we are the minority. If we're not spending time with sensitive people, we can often think there's something wrong with us, which is why I created my sensitive empowerment community. It's really, it is so profound to spend time together, because you're like, wow, you experience the world like I do too.
Mm-hmm.
And it really changes and normalizes and validates our experience. And that's a really powerful thing. And we work on things like developing self-compassion. One of the things that's fascinating about this trait is that this is a group of people that have the most compassion for others. We're some of the first people to jump up and help people. We almost always by default sacrifice our own well-being to kind of pull everybody into our raft and help them. But I often say that it's like, if we're pulling everybody into our own raft, then we're gonna all drown. So we have to make sure we're supporting ourselves, and we have to work on our, self-compassion is huge, because it helps with everything. It helps with resiliency. And it's really interesting that so many of us, including myself, really had zero self-compassion, really hard on ourselves. We have really high expectations of ourselves. As part of the trait, we want to get things done right the first time. We tend to be perfectionists. That tends to be issues for a lot of sensitive people. So kind of reframing some of those experiences and learning how to prioritize your own wellness before assisting everybody else, that's a huge one.
Mm-hmm. Yeah. And I've come across too, people sometimes can have a little bit of resistance to that, because they actually almost pride themselves on, or think that they're, especially the empathy piece, when you use that particular word, that like, that's an admirable trait. I want to be empathic, to those that are suffering, but I don't think they realize that they're literally like sometimes taking on, right,
Yes.
that pain and suffering in a really unhealthy, almost codependent, really kind of way.
Yeah, I mean, there's a saying that empathy without boundaries is self-destruction. And it is. I mean, we're taught from an early age, especially women, that we're praised to give up our needs in support of other people's needs. And obviously it's a positive thing to be in the world wanting to help and support people. But if we're all drowning, we're not helping anybody. So it is a switch of mindset to work on. And I had to do the same thing because all of our defaults seem to be to skip our own needs. And it's like we had to retrain ourselves to actually take care of ourselves, to pay attention to our inner child who's been wanting our attention for a long time. And this is life transforming, because when we do that, we actually have more to give to the world if we're balanced and well.
Right. Right. And people don't know that. They don't understand that. Yeah. I'm thinking about the men too, right? Like how traumatic is it for the highly sensitive man, growing up as a little boy and maybe, crying or, being emotional, and how that's a trait that in our culture anyways is, frowned upon, and don't be a sissy and whatnot. What's been some of the more maybe unique experiences of men that you've worked with that have this trait?
It's really interesting, because if you think about, one of the only emotions that we allow men in our society is anger.
Yeah.
And that's a problem if we're not allowing, the natural experience of emotions, and to get told that there's something wrong with you for your sensitivity, which is why I think it's so important to have this grassroots movement, that we make these paradigm shifts, that we change this message that we need sensitive people in the world, and we're here for a reason. This really evolved for a reason. And we even find it's already been found in over 100 species as well. So it's not just humans. I have a whole household full of pets that have this trait also.
Wow. That is true. Yes. I have noticed that with like cats and dogs and stuff, right? Some seem to be more sensitive and attuned to like the emotional state, right? The mood of their owner or the people in the house. And they get really, triggered when we get triggered. I've noticed that.
Absolutely. We have more activation in the insula part of the brain that is really this conscious awareness. We have more activation in the brain mirror neuron part of the brain, where we're literally firing some of the same neurons as the person we're observing. That certainly impacts us. We have more activation in the amygdala, which is part of the fight flight. So these are all things that are really important to know about us, and that our experiences are different from most of the people around us. And a lot of people have gotten invalidated for that. You know, we might be picking up on something like, that person doesn't seem genuine, or maybe they're not being honest, and something's not quite right. I'm picking up on something intuitively. And then they're getting told, what's wrong with you? I don't see that. So if we're constantly getting those messages from childhood, what does that do to us? Then we're really invalidating our experiences, and you kind of feel like something's really wrong with you. So it's very powerful. I have people in the community joining even in their 70s and 80s. And it's so exciting to me that people are starting to learn about this. It's getting more well known, and in every circumstance, it's life-changing to understand it.
Yeah. I notice when I work with these folks that we often have to get into, like, bring some consciousness to the subconscious beliefs, like the core beliefs that they hold about themselves, which do get formed in early childhood. And I find that a lot of people have learned not to trust their knowing. They don't, if you're told, oh, that's just your imagination, or you're just being sensitive, it's so dismissive and invalidating, as you say, then you come to believe, well, then I must be wrong, or I don't know what I'm talking about, I'm just stupid, or some sort of negative self-perception.
Yes, absolutely. That's something that we have to work on, are some of those mindset shifts to teach people how to really trust their intuition and believe it. And that's one of the reasons why it's important to spend time with other sensitive people. So you're getting validated for your experiences, that you can talk about it. It's really exciting to me when people talk about it in the community. They're like, wow, I've never been able to talk about all this stuff in such a safe space before, where people get what I'm saying and they understand me and I feel seen. And that's a very powerful experience.
Yeah. What do you say to the client or person who can't see the positives, that is still in that mindset of, this is a bad thing that I'm so sensitive? I don't see, how could this possibly be a gift? How could this possibly be something positive? What would you say to that person?
Well, I mean, it's so painful to see people in those places. And I understand what that is like. I used to think that sensitivity was the first thing I would change about myself before I understood it. And I thought I was weak. I thought I was fragile, thought something was wrong with me. I didn't even think I was smart, because we have to understand that, if we're thinking about the brain as two parts, like the cognitive and the emotional brain, for a lot of, I kind of call them untrained HSPs. So if we haven't really learned about this trait in some of these tools, we have the emotional brain is activated a lot, and that actually makes the cognitive brain go to sleep. So you lose access to memory and focus and all kinds of things that you need. And that's why, there's a lot of misdiagnosis, in fact, that we think something's wrong with the child or with the person. But in fact, when we teach them how to activate that cognitive brain and come back online, then it supports the emotional brain, and we can have more accurate messaging. So that might be some of what we would do, is work on some of those particular tools and certain triggers. There's like a breath technique that's really powerful. For example, you breathe in for the count of 4, you hold it for 2, and you exhale for 7, and you do that about 5 cycles. And what that does is it sends a message to your brain, I'm not in danger. I don't want you to sound out all the alarm bells, because the brain cannot tell the difference between a real threat and a perceived threat. So even if you get criticized or something like that happens, your brain can set off alarm bells, and it changes everything. It changes how you use oxygen, in fact. Puts it into your muscles, so you get tight. That's why people get a lot of back pain when they're stressed. And being able to do that breath technique is amazing, because anybody can do that. You can teach it to children and teens as well. And it sends that signal to your brain, because we don't breathe with a long exhale when we're in high stress or activated fight flight. So that's why it's kind of incredibly powerful to use, simple tools like that. I call them brain training tools. That's something that I'm really into, is brain training for sensitive people, because it helps a lot.
Well, right. I mean, and we talk about that too from the trauma perspective, right? That just dovetails perfectly with this, because the person who's experienced a lot of trauma in their lives, and it doesn't have to be the big T trauma either, just those little like T everyday kinds of traumas. We know that people who have that, kids, it changes the way their brain develops. They become more highly attuned, like hypervigilant, right? They're always looking for the danger, right? They're scanning their environment for danger. And so they're almost primed to get into that fight flight activation in situations that are not actually life or death situations.
Yes, absolutely. And it's incredible to develop a set of tools, because you start to feel like you're going to be okay. Like you're carrying tools in your pocket. They're there for you when you need them. It's really incredible to start to make that shift, that you can go out into the world. You're not going to be constantly overwhelmed and overloaded, that there's things that you can do that will support your sensitive system.
Yeah. And that's the empowerment piece. And that's such a big part of this work, right? Is empowering people to know that you're not a victim of this, that you in fact can learn tools and techniques and shift mindsets and whatever, rewire your brain, so that you can have a sense of control, a sense that I can manage, even though the world's going to keep coming at me, that I've got ways to manage that. I find that super empowering for myself and for my clients too.
Yeah, me too. It was really life-changing for me. I wouldn't be doing any of the work I'm doing right now if I hadn't gone through this process myself. It used to be when I was younger that I just wanted to get into my room, close the door, lock it, and shut off the world. And because it just felt too overwhelming. And I know there's so many people out there that are struggling with anxiety and depression and sensitivity. And I just really want people to know that there's a better way. And there's a lot of natural holistic ways that work better for sensitive people. I can't tell you how many clients I had come into my office who have been put on medications and misdiagnosed for things that they don't have and they don't need, and the medications are actually harming them. So, within a week or two of certain brain training techniques, they're actually, feeling relief that they have never had. And so it's incredible what actually can help.
Yeah. Let's talk about the misdiagnosis thing, because you brought that up a couple of times. What would you like other mental health or other healing professionals to know about this trait? How does it show up? What things are they misdiagnosing people with that they maybe don't actually have? What does the professional need to know about this?
I really believe that anybody that has symptoms of anxiety should be screened for this trait. And I do have a free sensitivity quiz that they can take. And I have a letter that you can give your medical and mental health professionals. That's a free download. And that's a great way to really educate them. You want to make sure that they understand this trait before you're getting put on medications. And even depression, there's a lot of clients that I've seen that had been struggling for a long time with depression, but actually what we found out a lot of times that it was that lack of stimulation, because there's this balance that needs to be had. If we're isolating too much because we're overwhelmed with the world, then that can actually create symptoms of depression. But if we're out in the world too much without enough downtime and enough alone time, that can activate symptoms of anxiety, which actually can be sensory overload. In addition, bipolar is often misdiagnosed in this group of people. ADHD, borderline. These are some of the misdiagnoses if your practitioner does not know about the trait, and it is incredibly important that they know about it.
Right. And to really factor in the person's environment too, right? Like if I have a client coming to me and saying they have extreme anxiety, and maybe I'm starting to think, generalized anxiety, maybe I should find out more about the environment, right? Like what if they're living with somebody who has, a diagnosed condition, or there's violence in the home, or there's a lot of fighting, there's a lot of just like emotional intensity. How much of that anxiety is actually just them picking up on all of that?
Yeah, I mean, the answer is not just to give medication. I know that we see that a lot with medical professionals that are giving medication. They're not trained in that particular piece of information. They're not gathering that holistic picture of the client and patient. It is just so essential, like you were saying, to know the whole picture about what is going on, because we are so sensitive. We're impacted by medications more than the majority. So we most likely need lower dosages. We need to go on and off medications more slowly. So there's a lot of things that the professionals need to know when they're treating. And the thing is that I believe in this grassroots movement, which is why I created that letter, because I believe in advocacy. So every time somebody's giving that letter to that particular medical or mental health professional, imagine all the sensitive people coming after you that are going to be helped by that.
Yeah. I'm glad you mentioned the part about the medication and stuff. Even when I was working, so I know that my sensitivity for me contributed to my body breaking down and me getting really sick with Lyme disease and chronic fatigue syndrome. And when I was working, even with my holistic practitioners, sometimes they would just, prescribe off the bottle, say, oh yeah, take 10 drops of this stuff, like herbs, for example. And that dose, if I took that much, would floor me and knock me out. I needed to take 1 drop, not 10, right? So
yes.
Even though those medications, I was very responsive to herbs, homeopathics are really great, flower essences, I find those are super helpful for, sensitive people, but to really recognize that your body might need a different amount of this stuff than somebody else. And I don't know if you ever use muscle testing, but, I will teach my clients how to self-muscle test, or I will work with them so that we're actually checking energetically what your body is asking for, not just prescribing, off a template or based on, whatever they did their research on, which was probably a bunch of like white college males in their 20s, right?
Yes, absolutely. We need to trust what our body is telling us. That's the positives of being sensitive, is you usually know what's going on inside your body pretty early, and often before medical tests even show up. And that's something you want to make sure you're working with practitioners who believe you. When you go in and you have a symptom, you want a practitioner to believe you that this is real for you, and shop around for practitioners that believe you. I actually have an HSP practitioners directory on my website also, to work specifically with HSP practitioners.
Yeah, that's so important. I was dismissed, when they couldn't figure out what was wrong with me. I definitely remember a couple of times people implying directly or not so directly, that it was something in my head. It must be psychological. That's sort of the medical establishment's answer. If they can't explain something, well, it must be psychological. It's all.
Oh my gosh, it's horrible. I can't believe how many times I've heard, oh, we don't see it affect people like that, or, well, I don't usually see that. But the thing is, we have to remember 1 out of 5 of a doctor's patients are going to have this trait. So there's 1.4 billion of us out there. There's a lot of people with this trait. We're not alone. And this is real for so many of us. So, and you can actually find HSP practitioners who understand your experience.
Yeah, you really have a lot of resources that you offer people. You've mentioned a few of them. What other resources, I love sharing them on the show, what other resources would you suggest, either for the person who identifies as a highly sensitive, or a practitioner maybe who wants to learn more about it?
Yeah, one of the first places to go, and that's been really successful for a lot of HSPs, is my course, my brain training course. So it's called Brain Training for the Highly Sensitive Person: Techniques to Reduce Anxiety and Overwhelming Emotions. That's a great first step for a lot of people. And it also gives you 8 weeks free in my sensitive empowerment community. And the community itself is just an amazing place. And I have a lot of information on my website, lots of free information too. And there's even a tab that says tools that teaches the self-compassion technique. These are all free on my website. It teaches how to sleep better, because a lot of sensitive people struggle with sleep. And that's one of our really #1 priorities for wellness. And there's so much information. I have the HSP blog, the HSP podcast, so you can learn a lot. I know a lot of HSPs have shared, like, they've listened to every episode and that really changed their life. These are all free on my website. And I have free masterclasses too that really help people understand the trait. There's some about setting boundaries. There's some about anxiety. There's some about sensory overload, and things like that. Just tons of stuff on my website.
Yes, yes, it really is a treasure trove. What would, and what do you suggest for the friends or loved ones? You know, maybe these are people who maybe not themselves don't really identify as being sensitive, but maybe they have someone in their life who is. What do you suggest for the loved ones of those who have the trait?
Yeah, I actually it's also a free video on my website that's about the trait. And that's a good place to start, as well as introducing people to the sensitivity quiz, because that answers a lot of your questions about sensitivity as well. So those would probably be good places to start, as well as the blog and podcast for education about the trait. And there's even episodes about how to talk about the trait, how to share it with others. We cover, I'm very tuned into the HSP community about their needs. And I think just about every possible subject you could think of about this trait has been covered. So there's a lot of information. And we do a lot of live events in my sensitive empowerment community. People can connect to me directly that way also. And I'm in my community every day. It's my favorite place to be. And it's pretty remarkable. I kind of think of it as like the butterfly coming out of the cocoon of this sensitive empowerment community, because that's what's happening. Is sensitive people are getting empowered, and to see what they do in the world is incredible. I'm very interested in getting sensitive people into leadership positions, places where they can be a part of policy and lawmaking to work with systemic racism and climate change. Big stuff. I offer free scholarships to my brain training course for Black HSPs as part of Be the Change. So we do a lot of big work too, because I believe that it is the sensitive people who are needed in the world to make some of these changes.
Oh yeah. I mean, you're reminding me of like Temple Grandin,
Yes.
and like what she did, in that area. And it makes me wonder too, like how much of like the autistic and Asperger's community, again, who often get so pathologized for being different, how much their sensitivity, like this, maybe some of these tools and stuff are applicable for them. Do you find that you get folks, on the spectrum kind of showing up in this?
Yeah, I get asked about that a lot, and it's really fascinating. So for those of us that are high up on the scale of sensitivity, we actually have really similar experiences sensory wise. Some of the sensory sensitivities are very similar to those on the spectrum. But some of the differences are we happen to be able to, sensitive people can read social cues and facial expressions and body language and all that even more than most people. So that's one distinguishing feature that's different. But yes, the sensory overload is actually really similar for those of us really high up. So it's really imperative that we spend a couple hours alone time every day, spending time in nature every day, working on mindfulness and meditation practices. I kind of think about the nervous system as being a motor. And for most of us that haven't, if we haven't been trained about this, it's like, flooring the gas pedal on your car all day long and the engine is burning out. This is where we see chronic fatigue, and we see adrenal issues, and we see a lot of chronic autoimmune issues. We see a lot of that in this population. So thinking about ways that we can turn that motor down, slow that down. So we do, meditations, mindfulness practices, things like that. Nature is one of the best things to do as a sensitive person. Spend time alone in nature, connecting to a tree, connecting to the beautiful leaves and flowers and bushes around you when you're on a walk, just slowing down. Another thing is slowing down the mornings. And when you wake up, just don't jump up and get into your to-do list, but really slow yourself, slow your movements, give yourself that slow pace in the morning, because that will impact your whole day. These are things that have been profoundly impacting HSPs in a really positive way. There's so much to say, but these are some of the things that have been really helping.
Yes, agreed. What a gift that you're doing this work, and a contribution that's really needed from my perspective. So thank you for the work that you're doing and for all these wonderful resources, that you're offering. And we'll be sure to include all of this in the show notes. Any final thoughts you have? Any words, wisdom, maybe you'd like to share with the audience about what we've been talking about today?
I would just really like to send a message that sensitive people, to all of you, that you are really valuable and that you are really needed in the world. And that if you're struggling, there's a lot of things that you can do that will really help you. And once you lift off that weight of overwhelm, you're going to experience so many challenges, so many gifts will emerge, that you're some of the most creative, caring, compassionate people in the world, and we really need you. And I would like to just share that message, that you're very valuable.
Thank you. And thank you all for tuning in today. If you like this podcast, please do share, click like, make a comment. Let's get this information into the hands of more people who are seeking this and who don't even know yet they're seeking this. So thank you for tuning in. Thank you again, Julie, and tune in next time for another episode of Kaleidoscope of Possibilities.
Thank you for having me, and thanks for the work you do in the world.
Thank you for joining me for this episode of Kaleidoscope of Possibilities, Alternative Perspectives on Mental Health. This has been Dr. Adriana Popescu. If you enjoyed this episode, please like and subscribe and share with others. To find out more about me, my guests, and more, please visit my website at adrianapopescu.org. See you next time.